heartburn, chest discomfort, shortness of breath or tightness of the chest, throat irritation, sour and bitter taste in the mouth. Hi, I'm Dr. Jaideep Rao, and I'm a consultant surgeon in upper GI, gastrointestinal surgery, and bariatric and metabolic surgery. I'm a consultant here in the Arden JR Surgery in Mount Elizabeth Novena Hospital, and I've started my practice here since January last year. Before this, I was a senior consultant and head of upper GI section in Tan Tock Seng Hospital for the last 10 years before I started my practice. Gastroesophageal reflux is essentially when the stomach acid refluxes up into your food pipe. When there is small refluxes, it may not produce any symptoms at all. However, some of the common causes are heartburn, chest discomfort, shortness of breath or tightness of the chest, throat irritation, sour and bitter taste in the mouth. These can be exaggerated, especially at night while sleeping, where the patient can suddenly wake up because of the reflux. And these are the common symptoms of reflux. The most common cause of reflux is a condition called as a hiatus hernia, where there is a defect in the muscle or the muscle that in the diaphragm is slightly loose. This occurs in the area where the food pipe enters and becomes the part of the stomach. So because of this loose muscle, whenever a person ingests food, the acid that is produced in the stomach refluxes back up into the food pipe. There are various things that we can do to decrease the symptoms of reflux, and this includes one, stopping smoking, trying to reduce or cut off alcohol, trying to have less amount of spicy food. In terms of quantity of food, I would recommend to eat in really small amounts more frequently and not large meals. Also avoid aerated drinks and bubble drinks. This can distend the stomach and aggravate symptoms. One could also take medications when the symptoms worse. But however, if the patient has got a physical defect in the muscle which is causing it, such as a hiatus hernia, then we may need surgery to fix this. Whenever there are a condition when the reflux cannot be treated by dietary changes, lifestyle modification and medications, then usually intervention is required. And nowadays there are various methods that you can treat this reflux with. One of the methods is endoscopic intervention, and this is called as a strata, where you can use radio frequency to stimulate the lower esophageal sphincter and the mucosa there to cause a slight narrowing, and this in small and early cases of reflux can be treated with this. This is still a new and an experimental procedure and needs a long-term data. We also nowadays have another new method of treatment called as a LINX. Now LINX is a magnetic biodynamic sphincter, and what this does is basically it's a set of magnets that are held together by a bead. This is wrapped around the esophagus, and this is kept in a loose situation normally, and when a person has food, basically this will expand to allow the food bolus to pass through and prevent reflux from occurring. However, the standard method of treatment of reflux is the hiatus hernia repair with a fundoplication, where the stomach is kept within the abdomen and prevented from moving up into the chest cavity. Nowadays, all these surgeries are done in a keyhole manner, or we call as a laparoscopic method, and usually the downtime is quite short. The patient is admitted on the same day we perform the surgery, and usually the next day the patient can be discharged. Again, when in terms of recovery, we'll usually let the patient have liquid diet for the first week, a puree diet for the next week, and then a semi-solid diet for the 3rd week, and then the 4th week onwards, the patient can eat normally. We normally recommend that even after the surgery, the patients should follow a strict diet and should basically avoid spicy food, oily food, bubble drinks, etc.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.